When people are looking at my hip vlogs, one of the common questions is which approach to total hip replacement my surgery was. And it's a good question, I suppose, because their assumption is that the restrictions and the outcomes are going to be different depending on which approach one has. So it's posterior is common, anterior is common, and then there's one called lateral, which is much less common. But if you want to know a little bit more about the differences, then I would say check out this video. In general, the things you have to watch out for are that your surgeon is using a modern muscle sparing technique, no matter whether he's doing posterior or anterior. And if you do that, then my understanding is that you can have equally good outcomes regardless of the approach. There's a lot of information out there that is outdated about posterior being inferior and having more restrictions than anterior. But that's honestly based on some very old information and old techniques before the more modern muscle sparing techniques. So the important thing there is to make sure that your surgeon is up to date on his surgical techniques and is using a modern muscle sparing approach, because there are surgeons out there who are dinosaurs and still using the old school approaches and having all the restrictions and somewhat bad outcomes compared to more modern techniques. So do your research, check with your surgeon, make sure they're employing modern muscle sparing techniques. But other than that, you should be good to go whether it's posterior or anterior. And for my money, I would pick the one that my surgeon is most comfortable with. And as long as I'm comfortable and confident in my surgeon, I don't think I'd care whether it was anterior or posterior. If you've heard different information about these different approaches, please post in the comments.